Herkese merhabalar, iyi günler dilerim. Ben İmran Mehmet, British Education Bureau, BEB'den operasyon müdürü olarak bugün University of Southampton webinar haftamızın psikoloji bölümü webinarı ile birlikte sizlerle bir araya geliyoruz. Biz e, ben sözü kısaca e, üniversite profesörümüz, yani University of Southampton Psikoloji Bölümü profesörü Profesör Lynn Elliot'a bırakmadan önce çok kısa kurumumuzdan bahsetmek isterim sizlere. Bu arada University of Southampton dünya sıralamasında ilk 80'de ve psikoloji alanında da dünyanın en iyi 15 İngiltere Üniversitesi içerisinde yer alan bir üniversite. E, Hemen ben çok kısa kurumumuzdan bahsediyorum sizlere. Bizler BEB olarak, British Education Bureau, BEB olarak University of Southampton'ın Türkiye'deki resmi temsilciliğini yapan kurum statüsündeyiz. Temsil ettiğimiz üniversitelerin Türkiye'deki tanıtım faaliyetlerini ve bu tür organizasyonlarını düzenleyen kurum durumundayız. Ve 2002 yılında Oxford'da kurulduk. Türk kuruculara sahip bir yapımız bulunmakta. 22 yıldır İstanbul, Ankara ve İzmir olmak üzere üç büyük şehrimizdeki ofislerimizde öğrencilerimize danışmanlık desteği sağlamaya devam etmekteyiz. Uzmanlık alanımız tamamen Birleşik Krallık ve İrlanda eğitim sistemi üzerine olduğunu söyleyebilirim. Üniversitelerin araştırılması süreci, sizler için uygun üniversitelerin çalışması, başvuru işlemleri, konaklama, vize, kabul şartları, üniversitenin kabul şartları gibi tüm noktalarda danışmanlık hizmeti sağlamaktayız sizler için. Tüm danışmanlık kadromuz İngiltere ve İrlanda eğitim sistemine hakim bir yapıya sahip ve bu konularda e, eğitimler almaya devam eden uzman bir kadrodan oluşmaktayız. Birleşik Krallık ve İrlanda özelinde toplam 150 civarında üniversite bulunmakta ve bizler web olarak bunların 90'ının Türkiye'deki resmi temsilcisiyiz. University of Southampton'da bu üniversitelerden bir tanesi. Ve temsil ettiğimiz üniversitelerin az önce bahsetmiş olduğum tüm süreçlerinde e, kapsamlı olarak öğrencilerimize danışmanlık desteği sağlamaya devam ediyoruz. E, Bugün olduğu gibi University of Southampton webinar haftamız yarın itibarıyla son webinarını gerçekleştirecek. Ama tabii ki benzer faaliyetlerimiz ilerleyen süreçlerde de farklı üniversitelerle birlikte devam edecek. Bizleri internet sitemiz, Instagram ve Facebook sayfalarımız üzerinden takipte kalmanızı tavsiye ediyorum. Bu sayfalarımız üzerinden benzer etkinliklerin duyurularını paylaşıyor olacağız sizlerle. Yine İstanbul, Ankara, İzmir, Lefkoşa ofislerimizin numaraları da bu şekilde. Birleşik Krallık, İrlanda özelinde e, lisans, yüksek lisans, doktor olmak üzere hatta akademik yaz okulu programları ile ilgili de aynı zamanda. Ee, Merak ettiğiniz sorular olursa seve seve yardımcı olmak isteriz. Bu numaralardan bizlere ulaşabilirsiniz. Thank you so much, Professor Lynn Elliott. That's yours now.
Thank you very much. Right, let me share my screen. Okie dokie. Okay, is that showing all right? Yes,
Yeah.
good. Okay. Hello, everybody. Good afternoon. Thank you very much for inviting me to talk to you today. I thought I'd start by just giving you an overview of what we're going to cover. So I know a lot of you on the call today are obviously interested in psychology and clinical psychology in particular. And so what I want to do is talk to you about different types of therapy that we train people in clinical psychology, and also talk to you about some of the current trends and exciting new developments that are happening right now in the field. Once I've done that, I'll talk to you a bit about the School of Psychology here at the University of Southampton and the undergraduate and master's degrees that we offer and our entry requirements. speak to you a little bit about career opportunities, the support we offer our students, and then there will be time for some questions at the end. So it's a busy agenda, but hopefully exciting, and let's get started. So I thought it would be helpful to start by thinking about the role of the clinical psychologist. And as we know, they get involved in lots of different activities. And primarily this is in assessment and diagnosis of mental health conditions, such as anxiety, depression, schizophrenia, PTSD, personality disorders, the whole range of mental health conditions. So we're involved in assessment and diagnosis, and we also deliver different types of therapy. And I should have said at the start, I'm sorry, that I'm a professor in psychology and mental health, but I'm also a qualified clinical psychologist myself and have my own practice too. So we also deliver different types of therapy, and the most common one, at least in the UK, but also internationally, is cognitive behaviour therapy. So I'll spend some time this afternoon talking to you a bit about that. But as well as that core business in clinical psychology of sort of assessment and delivering therapy to help people with mental health conditions, we're also involved in consultation with a range of other types of mental health professionals within multidisciplinary teams. So, for example, psychiatrists, occupational therapists, social workers. So we provide a lot of consultation as well as direct therapy. As well as that, we're also educators. So I'm involved in training the next generation of clinical psychologists. And that's a really important part of the role, to make sure that we've got, you know, the next generation of qualified people available to deliver services. And we also engage heavily in research. So clinical psychology is a science, it's heavily evidence-based, and certainly internationally there's a real emphasis in clinical psychology on providing what we call evidence-based treatments. And I'll go on to talk a bit more about that in a minute. And we also regularly engage in CPD, so in continuous professional development, so that we can keep our knowledge and skills up to date, because the field evolves quite quickly. And as clinical psychologists, we're qualified to work with individuals, with couples, with groups, with families, and that's across the lifespan. So from children, young people, adolescents, right the way through to working with adults and older adults. And as I was saying, I was using these terms evidence-based therapy, and certainly the emphasis is on providing psychological therapy that is evidence-based. And by that, I mean therapies that have research that show that they are effective and helpful for a range of mental health conditions. And the predominant one, as I've said, that's used certainly a lot in the UK is cognitive behaviour therapy, and that's because it's one of the therapies that has the most evidence backing it up for its effectiveness across a range of mental health conditions. And what I've done in this slide as well is just give you a very simple and brief overview of the main sort of principles of cognitive behaviour therapy. So this idea that we all have thoughts, and these thoughts lead us to feel in certain ways, and as a result of that we behave in certain ways. And what happens when mental health conditions develop is that we have some dysfunctional patterns and dysfunctional cycles that help to maintain those conditions and help to keep us stuck. So the basic idea then is that our emotions and our behaviours are really strongly influenced by our cognitions, by our thoughts, by our beliefs, by how we interpret things about ourselves, about other people, and about situations. And so what we seek to do in therapy, which is really helpful, is to understand how all of those things link together. So the basic model is a causal chain where we encounter an event, it leads us to think in a certain way, which leads us to behave in a certain way, which leads us to feel a certain way. And what's really interesting about this, and what we do therapeutically when we're working with clients, is to help them to understand that there are different ways of thinking about the same situation, and some of them are helpful and some of them are less helpful. So to run you through some examples, if the event or the situation is that you notice a friend and they walk past you in the street and they don't say hello, one way that you might respond to that is to think, my friend didn't see me, I'll catch up with her later, it's no big deal. So then that might lead you to a behaviour of phoning your friend, having a nice chat, and then you sort of feel happy. What can happen is that you could have a different reaction to that same event. So from the same event, your friend walks past and doesn't say hello, you might have a different cognition, a different thought.
Sorry, you are mute. Yeah.
Ah, do I need to start again? Have you not heard any of that?
No. Just
Okay.
1 second. Yeah, we
Is that
can
okay?
hear you. Yeah.
Have you heard all of this slide, or do I need to?
Yeah.
Okay, sorry, I don't know what happened there. So the same situation can result in a different thought or a different interpretation, which leads to a whole catalyst of other thoughts, feelings, emotions, and behaviors. So the same situation, if you had that reaction of, oh my goodness, I've upset my friend, she maybe she doesn't like me anymore, I don't know why she hasn't said hello to me when she clearly saw me, that might then lead to a behavior of you avoiding your friend, perhaps not responding to a text message, and then feeling sad. And so what this example really clearly shows is that exactly the same starting point, the exact same situation, can result in a range of different thoughts or interpretations or beliefs in direct response to that situation, which then has knock-on effects in terms of our behaviour and then how we feel. And so one of the key things excuse me, in cognitive behaviour therapy that we do is we map out these cycles, and we individualize them for the people that we're seeing so that they can start to have an understanding of how their thoughts impact how they feel and what they do. And so just to think about these thoughts a bit more and how unhelpful they can be, we refer to it in clinical psychology as the negative cognitive triad. And this is the idea that, excuse me, we can have negative views not only about ourselves, so things like I'm weak, I'm worthless, I'm useless. We can also have negative views about the world. For example, people with anxiety disorders typically have thoughts around the world being a dangerous place. We can also have negative views about other people. So people, for example, with schizophrenia who might be experiencing high degrees of paranoia might think that other people are dangerous and out to harm them or out to get them in some way. So we can also have negative beliefs about other people. We can also have negative views about the future. So you can understand that if you have these negative self-beliefs and these negative views about the world and other people, it impacts how you might see the future. And so typically people come to therapy with thoughts about their future looking bleak and not very positive. And so you can begin to see this picture building up of which is typical of people when they start therapy, around having lots of these negative beliefs that are really central to cognitive behaviour therapy. And what we seek to do is identify these beliefs as part of an assessment and then look to address them therapeutically with the individual. And so what we do in CBT is that there are these 4 stages that we work through with each individual. And we start off by assessing and setting goals. And this is really about figuring out what are the clients presenting problems, what are they finding difficult at the moment, what goals do they want to achieve from therapy. So it might be, for example, that if someone's coming with a presenting problem of depression, it may be that they want to improve their mood. It may be that they're not currently engaging with things that they enjoy or seeing people that they want to see. They might be quite isolated. So their goals might be something around being able to engage more in things that they enjoy. It might be longer term things about wanting to get back to work. People with anxiety disorders typically have goals around reducing the fear associated with phobias, for example. So it's really important at the start of therapy that you set really clear goals with the individual. And then through that process, what we get to is what we call a psychological formulation, which is where we put all of our assessment information together into a model so that we have a hypothesis about what is causing and maintaining that individual's presenting problem. And then what that allows us to do is it gives us a roadmap through therapy that we can then start to work with those difficult thoughts, those behaviors, those emotions, so that we can start to help people manage those issues that they come to therapy with. And I'll talk you through in a second the range of sort of therapeutic techniques that are typical within cognitive behavior therapy that we can use to do that. And then going back to what I was saying at the start about providing evidence-based therapies, we need to know if therapy has helped the individual. So there's an evaluation phase at the end where we understand how much therapy has helped, and we evaluate its effectiveness for the individual. And typically we will use questionnaire-based measures that we use at the start of the therapy and at the end of the therapy, and we can look at how much change there's been overall for that individual. And so there are a range of therapy techniques that are associated with cognitive behavior therapy. So typically what we do at the start is ask people to keep thought diaries, because what they do is they help people to identify their negative thought patterns and identify the impact on how they're feeling and how they're behaving. We can then start to build up a bit of a pattern around how, if there are certain situations that are difficult for people that are triggering these negative thoughts. And then as we move through therapy, we can engage with various techniques, one of which is cognitive restructuring. And that really involves doing a deep dive into a particular thought and examining the evidence for and against that thought as a way of evaluating its validity. And then there are other techniques that we can use. So with anxiety disorders, for example, what we tend to do is expose people to their fear in a graded and safe way, and we ensure that they don't engage then with behaviours that we know are maintaining their fear. So if we think of an example, say there's someone that comes to therapy with a spider phobia. We might develop a graded hierarchy with them about exposing them to that fear. So it might be to start with, for example, that we would ask them to look at a picture of a spider and see how they felt doing that and whether that triggered their anxiety. If they were okay with that, we might move to the next phase in a graded hierarchy where we might put them in the same room as a spider, but not very close to them, to see if they can manage that anxiety. And you see what I mean? You can then build it up so that you can then get to a point where the individual is no longer feeling anxious about having contact with a spider, as an example. And you can do the same thing with height phobia. It's also a very common technique to use in OCD as well. So if someone's got a fear of contamination, we might do a graded hierarchy around exposing them to dirt. So we might ask them to put their hand in a piece of mud, for example. And this is done very collaboratively and at the client's pace, so that we're not forcing them to do something that feels too much too soon. Some other techniques that we use, for example, behavioral activation. What we know, for example, with people with depression is that they typically aren't engaging in the activities that they enjoy, and they're therefore not getting any positive reinforcement from engaging in those activities. So we try and encourage them to re-engage with things that they're enjoying, because we know that that will have an impact on mood. We can also engage in behavioural experiments to get people to test out their negative thoughts or the things that they're anxious about. And again, that's done collaboratively with the individual. And then as we progress towards the end of therapy, we typically engage in what's called relapse prevention. So it's talking with the individual about what triggers their symptoms, what they've learned from therapy that's helpful, what they can take forward when therapy is finished to keep them well and to ensure that they keep the gains that they've established from doing therapy. So those are the kind of key techniques. More recently, there's been a move in clinical psychology to integrate mindfulness with cognitive behavior therapy. So there's mindfulness-based cognitive therapy, and mindfulness is a type of meditation technique. And originally, MBCT was designed to help people with relapse in depression. And then there are other variants as well. So there's acceptance and commitment therapy, which alongside CBT techniques integrates the use of mindfulness and the use of values, so that individuals are living a valued life and are doing things that are in the service of their values. Developed for people with personality disorder, again involves some CBT, some mindfulness and emotion regulation. There's eye movement desensitization and reprocessing, which is a specific therapy that was designed to help people with trauma and PTSD. And then what's definitely coming online now is this integration in clinical psychology of what we refer to as trauma-informed care. And that's really about understanding the effects of trauma. We know that people with with many different types of mental health conditions, so not just PTSD, have experienced trauma in their lives. For example, people with schizophrenia, people with personality disorders. And so there's a real kind of push in the field at the moment to ensure that we're integrating trauma in the care and in the therapy that we're providing for people. So understanding it within the context of their presenting problems and the difficulties that they're experiencing, and ensuring that as clinicians we're engaging in trauma sensitive practices in therapy. So that gives you a sort of flavour of some of the newer approaches to therapy that are around and about in clinical psychology at the moment. But the other thing that I wanted to emphasize as well is that, yes, it's important that we're offering therapy for mental health conditions, but there's also been a recent trend to also be thinking about promoting well-being, as well as treating mental health conditions. And so quite a lot of the work that we do is around building resilience in individuals and sort of doing strengths-based working. And what I mean by that is kind of helping an individual to gain an understanding of their own strengths, of their own positive beliefs that they might have about themselves, and really working to harness that as well as treating difficulty, so that we've got a balance therapeutically in what we're doing. And I think it's also important as clinicians that we take care of ourselves when our job is to take care of other people. And so there's very much an emphasis in the field of clinical psychology in terms of enhancing clinician self-care as well. Excuse me, I'm just going to pause for a drink. So moving on to sort of current trends, I really wanted to talk to you and emphasize the really exciting developments that there are in mental health care around the use of technology. So with the COVID-19 pandemic, there was a really large increase in the use of telepsychology and telehealth, and there's much work that's going on now around providing therapy sessions remotely online on Zoom. I've done that myself. It's interesting. It's really helpful for people that might not otherwise be able to access therapy, and it's a really nice way of ensuring that what might traditionally have been underserved populations can actually have access. It can also be helpful for people that are at work and may have less time to actually come to a clinic to see a psychologist. So it's a really good way of ensuring that clinical psychology and therapy is available to a larger number of people. And then there's also been some really exciting developments in the use of digital therapeutics and apps. So there's a lot of mindfulness-based apps at the moment. You might be familiar with Headspace, for example, which is a great mindfulness app. There are loads and loads of different online platforms that you can use now for different types of therapist exercises, for self-help, for cognitive behavior therapy tools that can kind of complement therapy. So this is a really big and emerging element of the field. There's also some really exciting work being done in virtual reality. So there's been some research that's been conducted that has shown that virtual reality is really helpful for dealing with height phobia, where you expose the person to phobia in virtual reality. And there's some evidence emerging that's helpful in the treatment of phobias, and that learning then gets generalized. So I think virtual reality and artificial intelligence is really going to come online a lot more in the next years as the technology is also evolving. And then there are also tools that are being developed to help us with assisting in the diagnosis of mental health conditions, personalizing interventions and therapeutic approaches, which again is sort of what's happening at the moment. So lots of really exciting and interesting developments in technology. There's also, I wanted to mention briefly, a real emphasis in clinical psychology globally at the moment in terms of cultural competence in therapy. So looking at the impact of things like race, gender, ethnicity, sexual orientation, and how those cultural factors really impact on mental health, and ensuring that those are integrated when we're understanding an individual's presenting problem, and that we are delivering therapy in a culturally sensitive way. And so that's something that's really come into focus with the emphasis on equality, diversity, inclusion globally as well. And indeed in the UK, it's heavily focused now in the curriculum in clinical psychology training programs. So again, this is an area of development and growth in clinical psychology. And then there has also been an emphasis more on prevention and early intervention. So how can we address mental health issues and concerns early before people transition into crisis? And so there's been a movement in terms of promoting mental health more in schools, in the workplace and community. And then when things do start to escalate, really trying to intervene early to try and prevent things becoming more of a long-term issue. And there's been a focus here specifically on targeting what we might call at-risk groups, so people, so adolescents and young adults. So the prevention and early intervention agenda is really strong at the moment in clinical psychology, and rightly so. And then finally, in terms of current trends, I just wanted to highlight neuroscience. I'm aware that there are some people on the call this afternoon that might be very interested in the intersection between mental health and neuroscience and the brain. So there have been some really interesting studies and advances in neuroplasticity research, which is showing how therapy, how mindfulness, how different therapy techniques can change the brain structure and function. And there are emerging therapies as well that are underpinned by neuroscience, such as brain stimulation therapies, such as TMS. And what we're really doing in the field is using brain to the different mental health conditions, including depression, anxiety, schizophrenia, and PTSD. So this intersection between mental health and neuroscience, I think, is really exciting, and again is sort of one to watch in terms of future progressions. So that gives you a bit of a whistle-stop tour through clinical psychology, through cognitive behaviour therapy, and what some of the exciting and emerging themes are in the field. And I think, you know, there's lots going on. It's really exciting. It's rapidly evolving. And I think really what the future involves is us continuing as a profession to integrate cutting edge science with the application of that knowledge to clinical practice. So I think, yeah, it's a really exciting profession, and I think it's yeah, really interesting, and I know there's a lot of people on the call that are keen to develop it. So that gives me a nice segue into talking a bit about our programs. And at Southampton, I thought I'd start by showing you this slide, because this is the School of Psychology, and it's nice to be able to sort of picture where you might study if you decide to apply to Southampton. It's a great campus, it's green, it's leafy, and I read recently that Southampton is in the top 10 of UK cities that have the most sunshine. So we probably don't have as much sunshine as Turkey, but we're certainly in the top 10 in the UK. And the psychology department at Southampton, we've got a really strong history of excellence in education and psychology. We're a big department. We've got more than 80 academic staff. We've got lots of students, and We're one of the leading UK providers of postgraduate research and professional training, professional clinical training. And so what that gives you is an opportunity to really study alongside clinicians, educational psychologists, practitioners, postgraduate trainees. And I think that's important because it gives you a really good experience, and that's something that we're really committed to in psychology in the delivery of our education. And we have a Centre for Innovation in Mental Health, which is one of our 4 key research clusters in the school, where we're doing some really exciting and innovative research, which our students get to hear about in relation to developing new therapies, in relation to understanding anxiety, depression as it occurs in children, as it occurs in adults. So there's some really exciting research that we're doing here in psychology that you would have the opportunity to get involved in. So just thinking about our undergraduate offer, we offer a BSc in psychology, which is a 3-year undergraduate programme, and we also offer a BSc in psychology with a year in employment, which is 4 years. So what happens in that case is you come to us and do your first 2 years of the degree. You then go out in your 3rd year to do a year in employment. We have people working in the mental health sector, we have people working in industry, and we will support you to find a placement that meets your career needs and your career goals. All of our undergraduate degrees are BPS accredited, so they're accredited by the British Psychological Society, and that's really important because it provides you with something called the Graduate Basis for Chartered Membership. And if you're keen to pursue a career in clinical psychology and want to go on to do professional postgraduate training, you need to have the graduate basis for chartered membership to be able to do that. So what that does is it opens a doorway for you to pursue postgraduate clinical psychology doctoral training, if that's what you would like to do. So those are our key undergraduate offers. In terms of entry requirements, at A level it's AAA or it's AAB if you have psychology or science, and our admissions teams will be able to advise you on the international equivalents of those qualifications. I've put the admissions email address on the slide there if you want to follow up with them. But that's our standard entry criteria for our undergraduates. And I also wanted to just very quickly give you a sense of graduate employment, because you'll want to be thinking about what you want to do after you've finished your degree with us. And for some of you, it might be pursuing a postgraduate course in psychology. For others, it may not be. And I thought it would be helpful just to give you a sense of the types of career paths that our graduates have pursued on graduation. So as well as going into the NHS and private healthcare, they've worked in the civil service, in youth justice, in the police, in national statistics, in banking, in the private sector. And we're really proud of the fact that 94% of our psychology graduates were in employment or further study 15 months after graduation. So our employability statistics are really good. And just to support that, these are the types of graduate jobs that our students have gone on to work in. And you can see that there's a range of sectors from health, mental health, physical health, PR, marketing, public sector working, teaching, human resources. So a psychology degree really does set you up for a range of different career options depending on what you want to pursue. And then moving on to our master's program. So we have a straight master's in psychology, where we have different pathways. So you can take a research methods and statistics pathway if you're really keen to develop statistics skills. We also have a cognitive psychology pathway and a social psychology pathway, depending on what subdiscipline of psychology you're interested in. We also have an MSc in health psychology, and we also have an MSc Foundations in Clinical Psychology, where you'll go into a lot more detail about CBT, for anxiety, for depression, learn about different therapeutic skills, learn much more about the evidence base. And in all of our programs, you'll have the opportunity to do a research dissertation where you will have a supervisor that will oversee a piece of research that you lead on. And that's exciting as a way of really pushing the science forward and learning new knowledge and generating new knowledge. And in terms of our entry requirements for our postgraduate degrees, you need a 2-1 or equivalent degree in psychology or a related discipline. So provided that you can show that that your degree has involved some degree of quantitative research skills, we'll consider you. So if you're not doing a degree in psychology, don't panic. We do consider other disciplines provided they have this quantitative research skills element. And then for our MSc Foundations in Clinical Psychology, we have an additional requirement, which is that we require at least 2 weeks of relevant work experience in a mental health setting. So this can be anything from paid experience or a paid placement that you might already have done, right the way through to volunteering. So you might have volunteered, for example, for a student self-help line or in a local charity that's mental health related. So it's quite broad what experience we're looking for, but it has to be of at least a 2-week duration. The other thing I wanted to just highlight here is that in the UK, and this is a question I often get asked, so I thought I'd preempt it and answer it for you. Graduating with our MSc Foundations in Clinical Psychology doesn't mean that you can then go on to practice as a clinical psychologist in the UK. To do this, you need to complete the doctorate in clinical psychology, and I'm very happy to take any additional questions that you might have about that at the end. In terms of career options, once you've finished your master's degree with us, a lot of our graduates go on to work, do some more research work in academia. So that might be as a research assistant. It might be undertaking a PhD. Our graduates have pursued clinical posts in health psychology related sectors, in clinical psychology related sectors, which provides the necessary experience that you need to apply for the doctorate in clinical psychology, which is an additional 3-year professional training that we offer in the UK to become a clinical psychologist. But we've also had our graduates from our MSc programs working in the civil service and working in charities. Just wanted to touch briefly as well on the support that we offer for our international students. So there are central university resources, including a student wellbeing team. We have a centralised career support so that you can really kickstart your career in the UK or abroad if you decide to do so. We've got a dedicated visa team. You get support with accommodation, with scholarships. And I also wanted to just highlight that we have an international student guide that you might want to download from our website, which I've put the website address there on the slide for you if you want to download that. And then we also have an Ask a Student button on our website, because there's nothing more helpful usually than hearing from our students about their experiences. So if you have a particular question that you'd like to ask a student, you can type it into our website, and we have an international student panel who'll be able to answer your questions. And then finally, student support in psychology. So every student that we have in the school has a personal academic tutor who looks after their academic and pastoral needs. Each module has a module lead where you can go to them to ask specific questions about teaching content or assessments. We obviously have programme directors, and all of our academics have weekly office hours so that you can drop in if you have any questions, or you can make an appointment if you prefer. So that's a whistle-stop tour from me. Thank you very much for listening. If you've got any questions, I'm very happy to answer any questions that you might have. And thank you very much for listening.
Thanks so much, Professor Linellet, for the great presentation and all the information pasted lecture. We can wait for the questions. I'm providing information, I mean announcement in Turkish as well. Sorularınızı yazılı olarak chat box üzerinden ya da sesli bir şekilde el kaldırma butonuyla bizlerle paylaşabilirsiniz. Sizler merak etmeyin. Yani üniversite hakkında olabilir, konu başlığıyla ilgili olabilir, psikoloji bölümüyle ilgili olabilir. Tüm sorularınızı yanıtlamak isteriz. I think Fatin Uğurlu has a question. Buyurun lütfen. Duyabiliyor musunuz şu an? El kaldırma butonuna bastınız galiba. Daniel Kaufman, it's written there, but yeah, we have one question now. Would you be able to elaborate on what skills would you seek for an undergraduate of a different field than psychology to have for them to be able to pursue a master's degree in psychology?
Yeah, so what we're really looking for there is that you've done, as part of your degree, you've done enough research methods training and statistics training to be able to manage our master's degrees, because at master's level in our degrees you'll do more advanced statistics training and research methods training, and you do the research project. So we need to make sure that you've got enough research methods and statistics training in your undergraduate degree to be able to manage that at master's level. So that would be the main thing that we would be looking for.
Thank you. The second question is, let me see, it's in Turkish. It's for the PhD psychology course. They would like to know whether they need to like study foundation after the undergraduate they studied in Turkey for the PhD course.
Yep, so you don't have to have, so different courses in different doctorate in clinical psychology courses in the UK have different entry requirements. But it's not you don't have to have done the master's in clinical psychology to apply for the doctorate in clinical psychology. That said, quite a high proportion of our applicants do have some degree of master's, but not all of them. You will need to have a degree of some relevant practical experience before you apply, and most courses require at least 12 months of relevant clinical experience before they will accept you onto a program. And again, that is quite that can be quite broad. So clinically relevant research is considered relevant clinical experience, as well as doing doing some work with service users or patients. So yeah, it varies by course, but essentially the minimum academic requirement is an undergraduate degree, but quite a lot of people do have a master's, but it's not you don't have to have the master's. Does that make sense? I think someone else has asked about, just having a look in the chat, how widely accepted is the British doctorate in clinical psychology in other countries? That's a good question. Would I be able to practice in the US, for example, with this degree? The honest answer to that is I don't know, because different countries have different requirements to use the term clinical psychologist. And so I think I don't want to give you incorrect information. So I don't know if you would be able to practice in the US with a British degree. But what most countries do have is a clear outline of what their requirements are. So I would recommend that you have a look at what their requirements are, and see if it's equivalent. But basically, to answer the question as well, which kind of links to this, is a bit more information about the clinical doctorate degree. It's a 3-year doctorate degree here in the UK, and you do typically you do 6 placements, so you do 2 in each year of the program, and alongside where you get to obviously work with patients in different settings, in adult mental health, in child, in people with learning disabilities, in health contexts, neuropsychology. So you do placements. Alongside placements, you come into the university typically 2 days a week for academic teaching to learn about how you deliver therapy and the theory and the evidence base. And then alongside that, you also do a research thesis, which is examined at the end of the 3 years. So there's basically clinical, academic and research elements to the 3-year doctorate here in the UK.
Thank
So
you.
I hope that answers that question.
Yeah, Rania and Taha is thanking you for the presentation. The following question is, could you give more information about clinical psychology PhD program? How would it be for a foreign student? What are the requirements?
So by the clinical psychology PhD program, do you mean the doctorate in clinical psychology, or do you mean a research PhD that is focused on clinical research? Because they're different.
We can wait for the answer.
So you can do a 3-year research PhD in a clinically related research area, which I did, but that doesn't qualify you to be a clinical psychologist. If you want to be a clinical psychologist in the UK, you have to do the 3-year taught doctorate program.
It's for both, actually, I think. Yeah, a PhD and also doctorate.
So so somebody's asked, where can we learn the equivalence of 2-1 in the Turkish grading system? You could contact our admissions department about that. Rabi, I don't know if you want to come in at this point.
Absolutely. Things in terms of 2-1 in the Turkish universities, it's usually equivalent to a 3.0 and above. If your grading on your certificate says very good, that is what we consider at Southampton as a 2-1. If it's above that and excellent grading, then that would be considered as a first, and you would qualify for scholarships as well. Which brings us to the point of scholarships. I'm not sure if you are aware, but we do offer excellence scholarships for students from Turkey. Anyone who has an offer from the university at the postgraduate level would qualify for a 2,500 scholarship. In addition to that, there are many scholarships for different faculties.
Thank you very much.
And there was another question in the chat about, is it easy to get into the NHS as a clinical psychologist or assistant psychologist whilst doing the doctorate in Southampton? Really good question. So yeah, I mean, there are quite a few jobs in the NHS. So once you qualify, once you've done the 3-year doctorate and you're qualified as a clinical psychologist, yeah, there are jobs in the NHS. So that isn't typically a problem. The assistant psychologist role is slightly different. So this is a role that people tend to do to get experience to apply for the doctorate. So you wouldn't do an assistant psychologist role whilst you're doing the 3-year doctorate in clinical psychology. You could be an assistant for a year or 2 years before then going on to apply. So the assistant psychologist role in the UK is a route to gaining experience to apply for the doctorate. So you wouldn't do them both at the same time.
I think Deniz Mısra Gürol has a question.
Sorry, Imran, my connection.
We can hear you now. Can you hear us?
Ryan, can you hear me?
Yeah. Can you hear us?
Oh, should we take?
Deniz Hanım, sizin sorunuzu alabiliriz isterseniz.
Tamam. First of all, thank you for. I graduated from Koç University in clinical psychology. Now I want to pursue my career in clinical psychology. So I was wondering if it is possible this year to apply for a clinical psychology PhD at Southampton. I mean to start on September 2025. I just wanted to ask about it.
Yeah, so you've already done your clinical training and you want to do a clinical research PhD.
Yeah, I will defend my master's thesis on January, so I'll be graduated.
Okay. Yeah, you can do that. So the first thing to do is to think about what area of clinical psychology you would want to do your PhD in, and then find a supervisor that has that expertise who can supervise you. And the way to do that would be to look on our website, see who does research in what area, and then send an email to that member of staff, and say that you're interested in pursuing a PhD and perhaps a little bit about what you're interested in, and then you would have an initial meeting with that person if they have availability to take on a new PhD student, and then you would go through the formal application process through the university. But the best way to approach it is to find a supervisor first. And if you're interested in schizophrenia or paranoia, then that would be me.
Yeah, actually, I looked at your research area and realized that you're working with personality disorders and also mindfulness based research.
Yeah.
And that interested me a lot. So I'll
Drop me
be
an
very
email.
happy.
Yeah,
Okay, then.
please. Yeah, drop me an
Okay,
email. It'd be
thank you
great to
so
hear from
much.
you. That's okay.
Okay, it's nice to meet you again. Thank you.
Yeah, you too.
And the next question is, let me see. I would like to ask about the tuition fees and scholarship opportunities for international students. I'm sorry if you have already talked about that. I had a connection problem for a while.
Imran, I can say a few words here. Sorry, the internet just threw me out of the whole Zoom call. Our fees are currently at £30,000 for postgraduate, so 30,300 for the MSc, and pretty similar at the undergraduate level. In terms of scholarships, we do offer scholarships. I may have said this, but I got cut off. Specifically for Turkish students, it's the Excellence Scholarship for any postgraduate student, and they get considered for it automatically. And the faculty, the school as well, offer scholarships for students with excellent grades. But it's always good to check with myself or colleagues at the faculty and with Imran from BEB, who can give you a confirmation of what exactly you would qualify in terms of scholarships.
Thank you so much. We have a long question.
I just read that one actually, and I can just jump in at this point and respond to that. It's about different therapeutic approaches, and I'm really glad you raised that, because you're absolutely right that there are different therapeutic approaches. There's psychodynamic therapy, there's existential approaches, as you've said, and it's a real challenge in 20 to 30 minutes to try and pack everything in, but my thoughts on psychodynamic therapy. So I don't offer it myself. I think it does have a place in mental health care. I think the emphasis has been more on CBT, simply because it's the therapeutic approach that has the most evidence base backing it up. But I think it's about tailoring the approach to the individual, and yeah, using the approach that you think as the clinician will work best for that individual given their presenting problems. So you're absolutely right, there are different approaches.
Thank you so much. Maybe Rami, can you put your email address on the chat box? I'm also sharing our email address. So yeah, I think we covered all the questions. Thank you so much, Professor Linelet, for the taster lecture and all the information you provided, and also Rami for your support and information as well. We hope to see you face-to-face in Turkey as well in the really near future.
Thank you very much, Amran. Thank you, Professor Elliott, for the presentation today. And hopefully we'll stay in touch. If you need any further questions or queries, by all means, do let us know. We'll be happy to hear from you. And have a lovely day, everyone.
Thank you very much.
Have a nice
Bye-bye.
day.
Bye now.
Bye.